Anatomy of female reproductive organs. The reproductive organs in females are those which are concerned with copulation, fertilization, growth and development of fetus, and its subsequent exit to the outer world. The organs are broadly divided into external genitalia, internal genitalia, accessory reproductive organs. External genitalia, the vulva or pudendum includes all the visible external genital organs in the perineum. The vulva consists of the following: mons, pubis, labia majora, minora, hymen, clitoris, vestibule, urethra and Skinner's glands, Bartholin's glands and vestibular bulb. It is therefore bounded anteriorly by mons pubis, posteriorly by the rectum, laterally by the genitopleural fold. The vulvar area is covered by keratinized stratified squamous epithelium. Mons veneris, mons pubis. It is a pad of subcutaneous adipose connective tissue lying in front of the pubis and in adult female is covered by hair. The hair pattern of most women is triangular with the base directed upwards. Labia majora. The vulva is bounded on each side by elevation of skin and subcutaneous tissue which forms the labia majora. They are continuous where they join medially to form the posterior commissure in front of the anus. The skin on the outer convex surface is pigmented and is covered with hair follicle. The thin skin on the inner surface has sebaceous glands but no hair follicle. The labia majora are covered with squamous epithelium and contain sweat glands. Beneath the skin, there is a dense connective tissue and adipose tissue. The adipose tissue is richly supplied with venous plexus, which may produce hematoma if injured during childbirth. The labia majora are homologous to the scrotum in male. The round ligament terminates at its upper border. Labia minora. There are two thin folds of skin devoid of fat on either side just within the labia majora. Except in the Paris women, they are exposed only when the labia majora are separated. Anteriorly, they divide to enclose the clitoris and unite with each other. There are two thin folds of skin devoid of fat on either side just within the labia majora. Except in the Paris women, they are exposed only when the labia majora are separated. Anteriorly, they divide the clitoris and unite with each other in front and behind the clitoris to form the prepuce and frenulum respectively. The lower portion of the labia minora across the midline to form a fold of skin known as fourchette. It is usually lacerated during childbirth. Between the fourchette and vaginal orifice is the clitoris. It is a small cylindrical erectile body measuring about 1.5 to 2 centimeters situated in the most anterior part of the vulva. It consists of glans, a body and the pleura. The clitoris consists of two cylindrical corpora cavernosa erectile tissue. The glans is covered by squamous epithelium and is richly supplied with nerves. The vessels of the clitoris are connected with the vestibular bulb and are liable to be injured during childbirth. Clitoris is homologous to the penis in the male, but it differs in being entirely separate from urethra. It is attached to the under surface of the symphysis pubis by the suspensory ligament. Vestibule. It is a triangular space bounded anteriorly by the clitoris, posteriorly by the fourchette, and on either side the labia minora. There are four openings into the vestibule: urethral opening, vaginal orifice, and hymen. Opening of Bartholin's ducts, Skinner's glands. Urethral opening. The opening is situated in the midline just in front of the vaginal orifice, about 1 to 1.5 centimeter below the pubic part. The paraurethral ducts open either on the posterior wall of the urethral orifice or directly into the vestibule. Vaginal orifice are in hymen. The vaginal orifice lies in the posterior end of the vestibule and is of varying size and shape. In virgins and nulliparum, the opening is closed by the labia minora. but in pairs it may be exposed. It is incompletely closed by a septum of mucous membrane called hymen. The membrane varies in shape but is usually circular or concentric in virgins. The hymen is usually ruptured at the consummation of marriage. During childbirth, the hymen is extremely lacerated and is later represented by cicatrized nodules of varying size called carunculum multiformis. On both sides, it is lined by stratified squamous epithelium. Opening of Bartholin's duct. There are two Bartholin glands, greater vestibular gland, one on each side. They are situated in superficial perineal pouch close to the posterior end of the vestibular bulb, the virginal vulva bulb. They are pea-sized, yellowish white in color. During sexual excitement, it secretes abundant alkaline mucus, which helps in lubrication. The glands are of compound racemose variety and are lined by cuboidal epithelium. Each gland has got a duct which measures about 2 centimeter and opens into the vestibule outside the hymen at the junction of anterior two-third and posterior one-third in the groove between the hymen and the labium minus. The duct is lined by columnar epithelium, but near its opening by stratified squamous epithelium. Bartholin glands are homologous to the bulb of the penis in male. Skinny's glands are the largest paraurethral glands. Skinny's glands are homologous to the prostate in male. Two skinny ducts may open in vestibule on either side of the external urethral meatus. Vestibular bulb. These are bilateral elongated masses of erectile tissue situated beneath the mucous membrane of the vestibule. Each bulb lies on either side of the vaginal orifice in front of the Bartholin's gland and is incorporated with the bulbocavernosus muscle. They are homologous to the bulb of the penis and corpus spongiosum in male. They are likely to be injured during childbirth with brisk hemorrhage. Blood supply. Arteries, branches of internal pudendal artery, the chief being labial transverse perineal artery to the vestibular bulb, and deep and dorsal arteries to the clitoris. Branches of femoral artery, superficial and deep external pudendal veins. The veins form plexus and drain into internal pudendal vein, vesical or vaginal venous plexus, and long saphenous vein. Varicosities during pregnancies are not uncommon and may rupture spontaneously, causing visible bleeding or hematoma formation. Now, supply and lymphatics. The supply is through bilateral spinal somatic nerves, and anterosuperior part is supplied by cutaneous branches of ilioinguinal and genital branch of genitofemoral nerve L1 L2, and the posterior inferior part by the pudendal branch from the posterior cutaneous nerve of thigh S1 to 3. Between these two groups, the vulva is supplied by labial and perineal branches of the pudendal nerve. Lymphatics. The vulval lymphatics have bilateral drainage. Lymphatics drain into superficial inguinal nodes, intermediate group of lymph nodes, gland of Cloquet, and external and internal iliac lymph nodes. Development. External genitalia is developed in the region of the cranial aspect of ectodermal cloacal fossa, clitoris from the genital tubercle, labia minora from the genital fold, labia majora from the labioscotal swelling, and vestibule from the urogenital sinus. Internal genital organ. The internal genital organ in female include vagina, uterus, fallopian tubes, and ovaries. These organs are placed internally and require special instruments for inspection. Vagina is a fibromuscular membranous sheath communicating the uterine cavity with the exterior at the vulva. It constitutes the excretory channel for the uterine secretion and menstrual blood. It is the organ of copulation and forms the birth canal of parturition. The canal is directed upward and backward, forming an angle of 45 degrees with the horizontal and erect posture. The long axis of vagina almost lies parallel to the plane of inlet and at right angles to that of the uterus. The diameter of canal is about 2.5 centimeter, being widest in the upper part and narrowest at the introitus. It has got enough power of distensibility as evident during childbirth. Vagina has got an anterior, posterior, and two lateral walls. The anterior and posterior walls are opposed together, but the lateral walls are comparatively stiffer, especially at its middle. As such, it looks H-shaped on transverse section. The length of the anterior wall is about 7 centimeter and that of the posterior wall is about 9 centimeter. Fornices. The fornices are clefts formed at the top of the vagina due to the projection of the uterine cervix through the anterior vaginal wall, where it is blended inseparably with its wall. There are four fornices, one anterior, one posterior, and two lateral. The posterior one being deeper and the anterior most shallow one. Relations. Anterior, the upper one third is related with the base of the bladder, and lower two thirds are with the urethra, the lower half of which is firmly embedded with its wall. Posterior, the upper one third is related to with the pouch of Douglas, the middle third with the anterior rectal wall separated by rectovaginal septum, and lower third is separated from the anal canal by perineal body. Lateral walls, the upper one third is related with pelvic cellular tissue at the base of the broad ligament, in which the ureter and the uterine artery lie approximately 2 centimeters from the lateral cornices, but middle third is blended with levator ani, and lower third is related with the bulbocavernosus muscle, vestibular bulbs, and Bartholin glands. Structures. Layers from within outwards are mucus coat, which is lined by stratified squamous epithelium without any secreting glands. Some mucus layer of loose areolar vascular tissues. Muscular layer consisting of indistinct inner circular and outer longitudinal muscles. Fibrous coat derived from endopelvic fascia and is highly vascular. Vaginal secretion. The vaginal pH from puberty to menopause is an acidic because of the presence of Jordan's bacilli, which produce lactic acid from the glycogen present in the exfoliated cells. The pH varies with the estrogenic activity and ranges between 4 and 5. The arteries involved are cervicovaginal branch of uterine artery, vaginal artery, a branch of anterior division of internal iliac or in common origin with the uterine, middle rectal, internal pudendal. These anastomose with one another and form two azygous arteries, anterior and posterior. Veins drain into internal iliac veins and internal pudendal veins. Lymphatics on each side. The lymphatics drain into upper one third internal iliac groove, middle one third up to hymen internal iliac groove, below the hymen superficial inguinal vein. Nerve supply. The vagina is supplied by sympathetic and parasympathetic from the pelvic plexus. The lower part is supplied by pudendal nerve. Development. The vagina is developed from the following sources. Upper forepeak above the hymen. The mucous membrane is derived from endoderm of the canalized sinovaginal bulb. The musculature is developed from the mesoderm of the two fused Mullerian ducts. Lower one-fifth below the hymen is developed from endoderm of urogenital sinus. External vaginal orifice is formed from the genital fold ectoderm after rupture of the urogenital membrane. Uterus. The uterus is a hollow pyriform muscular organ situated in the pelvis between the bladder in front and the rectum behind. Position. Its normal position is one of the anteversion and anteflexion. The uterus usually inclines to the right angle, dextral rotation so that the cervix is directed to the left and comes in close relation with the left ureter. Measurement and part. Uterus measures 8 cm long, 5 cm wide at the fundus, and its walls are about 1.5 cm thick. Its weight varies from 50 gram to 80 gram. It has got following parts: body or corpus, isthmus, cervix. Body or corpus. The body is further divided into fundus, the part which lies above the opening of the uterine tubes. The body proper is triangular and lies between the opening of the tubes and the isthmus. The superolateral angles of the body of the uterus project outwards from the junction of the fundus and body and is called cornu of the uterus. Uterine tube, round ligament, and ligament of the ovary are attached to it. Isthmus is a constricted part measuring 0.5 centimeters situated between the body and the cervix. It is limited above by the anatomical internal os and below by the histological internal os. Some consider isthmus as a part of the lower portion of the body of the uterus. Cervix is cylindrical in shape and measures about 2.5 centimeters. It extends from the isthmus and ends at the external os, which opens into vagina after perforating its anterior wall. The part lying above the vagina is called supravaginal, and that which lies within the vagina is called vaginal part. Cavity. The cavity of the uterine body is triangular on coronal section with the base above and the apex below. It measures about 3.5 centimeter.